Welcome to Whitecoat Medicine. I'm Carlos Ornedo.
I'm Dr. David Cruz.
Welcome to the feature today of our anti-diabetic medications. As you recall, we talked about metformin the last time we got together. And so today, David, what are we going to
Today we're going to talk about sulfonylureas, which is a older medication that we use, and we want to explain that a little bit to you and tell you more or less how it works and give you some of the things to look out for with those meds.
Yeah, I think they've had like a couple of generations. They started off, I think, in the early 1970s with a medicine called chlorperamide. It was one of the first ones ever used for diabetes, and realized quickly that they probably needed to make cleaner, better medications. I think that one had like a 36-hour half-life. So
very long, very dangerous.
Yeah, very dangerous medicine.
So especially the way these medications work.
Yeah.
Now there's several medications we use which are the second generation medications now, and we're using things like that are called, you would see it on your can as glimepiride, glyburide, glipizide, those type of medications. They also have other brand name names like Amaryl, Diabetic, Micronase, and then these medications work in your body and the pancreas.
Yeah, and so the way that they're going to help the diabetics, of course, we're going to focus on, letting them eat better and exercise. But the medication itself will work in the cell, reduce the amount of sugar that it is in the circulatory system, and so by that we will have a reduction in sugar. Sometimes it works too good.
Yes, that's a problem a lot of times now. So when the medication is working on your cells, now in your pancreas you have beta cells, and the beta cells produce a lot of insulin. And sometimes it doesn't produce enough insulin. These medications will allow you to produce more insulin, and therefore your cells are exposed to more insulin, bringing that sugar down when you're taking care of yourself and doing, like you said, a proper diet and exercise regimen as well.
Exactly. And so, if they work so well, we have to be careful with some of the side effects with some of these medications.
Right.
Such as hypoglycemia. It can be a severe hypoglycemia, and I think at one point or another, glyburide was the one that was pegged as one that could have some really, really long-acting effects of low sugar.
That's one of the fears that we have, when we're using medications. It's very important for a patient to be checking their sugar at home. And because you don't know sometimes how these medications are going to respond. Now maybe your diet's differently now than when you didn't think you were diabetic. Now you're diabetic. Maybe you changed your diet a little bit, and now you're taking more medication than before, and your sugar drops too much. Some of these medicines stay in your body too long.
Exactly. And if you're like a person that's active and playing sports, you could very well find yourself in a hypoglycemic event. You're sweating, you're nervous, and realize that
not eating
exactly.
Right.
Could be the medication.
So that's one of the big risk factors that these medications have, of your sugar going too far down too fast. So you have to be aware of those symptoms of when your sugar goes too far down. What are some of the things you tell the patients about their symptoms being like low sugar?
Exactly. So when you take the medication, we always tell them you've got to eat. I know many of them that said, I didn't have time, I just took my medicine, but I felt terrible the whole day. I'm not sure what went wrong. I had stomach aches, a little nausea, and just taking the patient, tracing them back to realize that, I didn't eat. And so these are things that you have to be careful about.
Right.
And driving, and there's so many things that you're concerned about with some of these low acting.
A lot of things I tell my patients are, look out for certain things. Look out for your sugar being too far down by your symptoms. And your symptoms would be sweaty, you're shaky, your heart's beating very fast, you feel very confused, tired. That's where if you're driving, you might weave a little bit because your sugar's too far down. In those episodes, know that those are your symptoms and be aware of those things so that you can kind of take care of those things. And that's by eating something, taking a little sugar, by eating some fruit, drinking milk, doing something at that time.
And that's what we realize with some of these medicines, as we've been studying them forever and have the experience now. I think at the beginning they really didn't know where to use them, and they just made them better to where they're a little shorter acting, so they don't stay in your body like the initial first generation was 36 hours. It's quite a bit of time to have sugar drop.
And is there anything else that you would tell your patients, or when would you not use this medication? Let's put it that way. When would you not use this?
That's a very good question. I think on our elderly patients, David, they're, first of all, they've got so many medicines, and you're trying to just keep them straight in their meds and watching their diet and make sure that they eat and move a little bit, but always take them with food and wait a few minutes, sitting down position, and just get used to taking their medications probably at the same time every day.
Right.
So they can realize if I have any side effects of anything, it was probably that medicine.
Yeah. So the elderlies are a big risk for sure.
Yes.
Now, on the other hand, I think I would use the medication a little bit more on a couple of instances. I think first I would use it if I didn't know anything about them. Yeah. If I didn't know if their kidneys worked well, if their liver worked well, or anything like that. But I knew they were diabetic and I knew their sugars were way out of control. I would maybe use a little bit of this medicine until I knew what their kidneys looked like, just so that we won't put them in any type of danger. I also would want them to be checking their sugars often so that we can make sure that we're not overdosing them with these medications as well.
That's a good point. And I think a combination of our experiences today helps us realize that, our patients are going to experience some of the good and some of the bad of medicines, but, helping them realize that knowing the difference is important.
Right. So that's our little talk today on sulfonylureas. I hope that you enjoyed this little talk, and if you have any suggestions or recommendations or any questions about this, definitely reach out to us. Thank you for watching.
Goodbye.